Meanwhile, a fresh crisis looms in the health sector following the issuance of strike notices by two major medical unions. The Kenya National Union of Nurses has given the government 3 weeks to fulfill agreements in an earlier return-to-work deal, failure to which it will return to the streets in January. The union is demanding the implementation of a collective bargaining agreement signed in August of 2024 and employment of UHC staff on permanent and pensionable terms. Margaret Kimathi has the details.
Power.
Just 4 months after signing their collective bargaining agreement to the Ministry of Health, the Kenya National Union of Nurses has issued another 21-day strike notice. Led by the union's Secretary General, Seth Panyako, the nurses have accused the Kenya Kwanza administration and county governments of failing to meet their end of the bargain.
Our being silent and not disturbing this government is being taken for granted or being cowardized. We cannot, for example, allow UHC staff who are doing a lot of work in the villages being paid peanuts. And yet there is a lot of money in this country. We are saying they must be put on permanent and pensionable, because at Afya House we have 11 billion. To absorb these people into permanent and pensionable, you only need 7.8 billion.
Panyako expressed frustrations with the failure to implement a Salaries and Remuneration Commission circular recommending salary increments for nurses based on job groups. He has also criticized the lack of uniformity in salaries across counties, leading to disparities within the profession.
That the CPA directly affects and should be implemented for all staff who are deemed seconded. All nurses who are seconded, those who came from the national government, all these fellows we are seeing here, I'm seeing like all of them are seconded. So they should immediately have benefited from the current CPA as well as the 17-tier grading structure.
Under the 2021-2025 CBA, nurses were to have their risk allowance and uniform allowance increased by 5,000 shillings, with further increments expected in subsequent CBAs. Other issues raised include union rights, job classifications, and employment conditions.
There is even something like risk allowance that was increased in 2017 to only by 1,800 shillings, from 3,000, I think, 120 to 5,000. It has not been implemented. But if it was a tax, it would have been implemented immediately.
The county governments are assuming that they are autonomous government that should do their own things different ways, that are now interested in sending us to all 47 counties to negotiate and sign CBAs. We are saying that we are not ready to go on that route.
The officials maintain that the strike will proceed if their grievances are not addressed within the notice period. Margaret Kimathi, NTV.